December the 19th. We'll have the roll call vote.
Reverend
Roll call.
Gordon,
Here.
Mr. Arnold, Ms. Banks, Ms. Bell, Mr. Brown,
Present.
Ms. Carter,
Here.
Ms. Clark,
Here.
Ms. Friedman,
Here.
Ms. Harding, Ms. Howe,
Here.
Ms. Mendoza-Locke. Here. Mr. Knowles, Mr. O'Connor,
Here.
Ms. Rodriguez, Mr. Stengel,
Here.
Major White.
Here.
Ms. White.
Thanks. All right.
Banks. Here.
Thank you very much. We'll recognize our visitors. Starting with Richard.
Mary Beth Alberti, Arrowhead. Tina Lason, board staff.
Cynthia Brown Sherry, board staff.
Shannon Hedge, board staff.
Galloway, board staff. Amy Cookmeyer, board staff.
Robert Kasperzak, board staff.
Gabby McKinnon, Hospital Council of Northwest Ohio.
Julie McKinnon, Healthy Lucas County.
Dustin Watkins, Harvard.
Matt Bell, team recovery. Mike Carter, board staff.
Wyatt Jones, board staff.
Faith Gallagher, board staff. Latrice Flowers, board staff.
Carol?
Hello there, Carol Conlon, Lucas County Guardianship Services Board.
If I could take a brief moment and introduce the newest face in the family, Stefana Galloway. She is our accounting specialist. She's new. She just started on the 7th or 6th? Close. See?
Welcome.
Welcome, yes.
And we're so happy that she chose to join us. And also, I would be remiss in not mentioning that Harbor's new CEO, Mr. Dustin Watkins, is with us today as well. So welcome, Dustin.
Welcome, everyone. Thank you so much. Now, can I have a motion to adjourn into executive session for an pending legal matter? And we'll excuse our guests as we, following the vote on the going into the executive session.
So moved.
Second. Properly moved and second. Need a roll call vote.
Ms. Banks,
Yes.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Ms. Clark,
Yes.
Ms. Friedman,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza-Locke,
Yes.
Mr. O'Connor,
Yes.
Mr. Stengel,
Yes.
Major White.
Yes.
All right, we are adjourned.
Recording's off.
Executive session. It has been moved and second that we come out of executive session. Voice vote, all those in favor, let it be known by saying aye.
Aye.
Opposed? Those who abstain, and we are out of executive session. Thank you. Are there lights still turned off?
Yes, there is.
My imagination.
Other one.
All right. But you get my age, you need all the help you get. All right. Let's continue with our meeting, and we will have the meeting minutes. We have, thank you. Second. All right.
Ms. Banks,
Yes.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Ms. Clark,
Yes.
Ms. Friedman,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza Locke,
Yes.
Mr. O'Connor,
Yes.
Mr. Stengel,
Yes.
Major White,
Yes.
Ms. White.
Yes.
Ms. Bell is here as well.
Ms. Bell?
Yeah.
Ms. Bell?
Thank you. All right, they are approved. Let's move on to our treasurer's report, and Jenny.
Financial statements are on page 9, and you will notice it's for October and November. Normally, we would just bring you 1 month, but since we didn't have the planning and oversight committee meeting, we were able to bring in November into this, so we did 2 months in this one. So we received, in October and November, we received our quarterly allocations from Ohio Moss, and we paid our November grant payments. So you can see in our variances for July through November, we actually in the revenue have, we're pretty close to budget for, on a fiscal year to date basis. The largest dollar amount line item that has a variance is in the state revenue. And that is mostly due to the access to wellness grant. That got a little bit of a late start, but it's also trending to be underspent for the year. And then for revenue overall, we're at 93% of budget for the year. In the expenses, you can see in the grant funded program expenses, a variance of about 1.1 million on a fiscal year to date. Also embedded within that is the access to wellness grant, along with some other grants. Most of that underspending is timing in the year. We're not seeing a lot of true underspending at this point in the year. And for October and November, there was a decrease in net assets of just under 1.9 million. As I noted, we received our quarterly allocations from Ohio Moss, but it was offset by paying our November grant payments and other payments. On page 10 is the balance sheet as of November 30th. So in cash, you can see the decrease, and that was reflected because of our payments. And then I also wanted to point out, if you look all the way down under the fund balances line, you'll see a significant decrease in the infrastructure transformation project, the ITP project. That is well on its way with Ascend. You'll see a $262,000 decrease in that line. And then at November 30th, our non-designated board fund balance is at 17.1 million. There are payments on pages 11 through 15, and there is a motion on page 8.
So moved.
Second.
Properly moved and seconded. Any questions for Debbie?
What caused the variance in the IPP?
Oh, those are payments going out to Ascend. Yep. So as we've been paying them, we've also been taking it from the board designated funds.
Roll call vote.
Ms. Banks,
Yes.
Ms. Bell,
Yes.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Ms. Clark,
Yes.
Ms. Friedman,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza Locke,
Yes.
Mr. O'Connor,
Yes.
Mr. Stangle,
Yes.
Major White,
Yes.
Ms. White.
Yes.
Approved, thank you. And now the health officers.
Hi, everyone. I'm on page 16 of the board packet. Our health officer advisory group met to review new and renewal applications. We have 6 new applicants. And we collected their demographics. 3 identify as white, 2 identify as Black African American, and 1 identified as African American. Then we also have one renewal. There is a typo there. It says for renewal designation above the top 6. It should be for new designation. Those 6 health officers are actually new designation.
Oh, wow.
Yeah, I saw that and didn't change it. So I apologize for that. All of their applications were reviewed and are being recommended to become health officers. So, any questions?
Thank you.
Move approval?
Thank you. Second,
Second.
properly moved in second for approval. Questions? Comments, discussion? Roll call vote.
Ms. Banks,
Yes.
Ms. Bell,
Yes.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Ms. Clark,
Yes.
Ms. Friedman,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza Locke,
Yes.
Mr. O'Connor,
Yes.
Mr. Stangle,
Yes.
Major White,
Yes.
Ms. White.
Yes.
Thank you very much. It passes. And now Scott, if you'll discuss our legal fees.
Sure. Thank you, everybody. Draw your attention to the bottom of page 16. It's a fairly straightforward motion. On January 1st, our current legal representative, Crabb, Brown, and James, is joining a new law firm, Amundsen Davis LLC. Consequently, the contract that we have with them will need to be switched over to Amundsen Davis. So what will happen is, because it's Jan 1st, Edmondson Davis will actually be invoicing us for the services that were provided in December, and then if there's any residual in January. So we need authorization to enter into a new contract with Edmondson Davis, and then we are requesting to transfer the balance on the Crabb, Brown, and James contract to the Edmondson Davis contract. So both of those motions are on the bottom of page 16, and you can take them together.
Certainly makes sense.
So moved. Second.
All right, properly moved in second. Any comments, questions?
So the $96,903.87, you just said balance. That's not, is that what we owe them, or is that the?
That's the balance still in the contract as of December 1st. We've paid all the way through November 30th.
Gotcha. Okay.
And that means it could be more. That we owe.
There are definitely more that we owe them, because we owe them all the way through December's work, and then if there's any carryover into January.
So we owe them more than?
I don't know what we owe them.
Okay.
We've not received the invoice. All I'm
Okay.
asking for is the approval of move whatever is remaining from the allocated funds for Crabb, Brown, and James to Edmondson Davis.
Okay, so that's where I'm getting confused. So we're talking about the allocation, we're not talking about their bill.
We don't
Correct.
have their bills yet, correct?
Gotcha, okay.
Thank you for that distinction. All right, roll call vote.
Ms. Banks,
Yes.
Ms. Bell,
Yes.
Mr. Brown,
Yes.
Ms. Carter,
Yes.
Ms. Clark,
Yes.
Ms. Friedman,
Yes.
Ms. Howe,
Yes.
Ms. Mendoza Locke,
Yes.
Mr. O'Connor,
Yes.
Mr. Stangle,
Yes.
Major White,
Yes.
Ms. White.
Yes.
And it passes, thank you. All right, we have a presentation, or health assignment presentation.
Elijah Jones.
Good afternoon, everyone. On the back of your packet, there's some information on the Lucas County Health Assessment. This is a process the community goes through every 3 years. And this board provides some funding to contribute to that. And we use the data from that in our planning. It's reflected in the outcomes, priority outcomes framework that you see in the outcome reporting. And today we have people here to provide an overview of some of the data that is related to behavioral health and substance use. And I'll introduce our guests here. We have 2 McKinnons, not related. Gabby.
Oh, that's funny. I thought it was mother and daughter, possibly sisters.
I know actually, I know they're not.
You know, it's right there,
But Gabby McKinnon
Sisters.
from the health department, not the health department, but the Hospital Council of Northwest Ohio, and Julie McKinnon from Healthy Lucas County. Gabby will be giving us the presentation, and Julie will be here to answer questions or if things go awry.
Woo! Yay!
Do we need to recognize our own verification in this whole process?
No, I'm just sorry.
You were the chair, right? Or
Yep.
co-chair
I'm
of
the chair
the
of Health.
Healthy Lucas County
Yeah.
that organizes this and.
And I know that they're not related. So they're great. So I'm excited to see my babies here today too.
You want to do this?
No. You do the hard part. I just get to say
Okay.
the fun stuff.
Okay.
Raise your eyes.
Hello, good afternoon. Good afternoon. Well, we're going to be reviewing a lot of fun stuff today, going over a lot of data. My name is Gabby McKinnon, again, not related to Julie. Together, just kind of happened, that was very random, but pretty funny. I have been with the Hospital Council for the past a little bit over 4 years now. And specifically, I have been the project manager working very, very hard on this for the past, now Julie, over a year. Well, this specifically over a year, right? So again, this is all of the sections that were in throughout the entire report. That's what we went over, I think it was last Tuesday. But specifically today, you guys are getting the shortened version. So everything that is in specifically the bold is what we'll be going over. Again, all of these sections are for the adult, child, and youth. Also, we did oversample Latinos and African Americans specifically for the adult population, so that data will be included in here. All right, so the first thing, we're going to take a very, very, very brief look at the methodology. So first and foremost, the design. So we do lump the adult and child specifically together because they are very similar methodologies. So for both of those, we do have a written survey that is sent out into the mail. Specifically for this, though, we did add a new option, something that we pilot tested for a couple years, and so we're trying to move towards is the online. We're trying to move away from the mailing. So specifically for the written surveys for the adult and child, there was a QR code that was put up in the corner for adults or parents to take if they choose to. Again, something very easy. The entire questionnaire was on there. And then for the youth, it stayed the same from the past cycle. So before, we did actually used to go into the schools and survey, paper, pencil, all that. It's just a lot to survey and coordinate with the schools. So what we have moved is to specifically electronic via SurveyMonkey. So we work with the schools, figure out a good time to survey. We provide that survey link to the principal and to the teachers, and then they go ahead and let the kids take it. So then moving down to the instrument development. So a majority of the questions came from the BRFSS for the adult, the WIRE BSS for the youth, and then the NSCH for the child. Yes.
And what does that mean?
Okay.
I'm sorry, but I'm not familiar with those acronyms.
No. Okay. So those specifically are from the CDC. So that's how they collect data. So the BRFSS. I'm sorry, I don't have my notes today. It's the Behavioral Risk Surveillance System Survey.
So that's what the CDC uses to specifically what the questions that they ask for the adults. And then the YRBSS is the Youth Risk Behavioral System Surveillance Survey.
Okay,
That's what they use. And then this other one is the National Survey for Children's Health.
okay.
So those questions. Oh,
Were
sorry, go ahead.
incorporated into your questions?
Yes.
Is that what I'm hearing you
Yes.
say? Like you used their questions
Yes.
for this?
Yes, so we specifically use those questions so that we can compare state and national data. So we compare it through to Ohio and then on one column. So if you were to look at our comparison tables, that'll show up, that'll pull up. So we have Ohio and then we have US. Okay, does that make sense? Okay, yeah, no problem.
Totally.
So specifically for the adult questionnaire, so we did cut it down quite a bit. I think last cycle it was around 110, 115 questions. So we did cut that down to 79. Again, why did we cut that? We're just seeing an overall shortage in the amount of people taking paper pencil surveys. So we felt that if we shortened it, more people would want to take it. Specifically for the youth, there was a 75 question questionnaire and a 69 question. Why 2? So specifically in the 75 questionnaire, there are questions about sexual behavior. When we meet with the superintendents, because we surveyed the Toledo-Lucas County Public Schools, if it was up to them whether or not they wanted to include those sex questions or not. So it's a total of 5 questions. Again, if they don't have it, that's completely fine. And then at the very bottom, we see that the child's questionnaire was 76 questions. Good?
The logical question is how many school systems opted for one or the other?
We will get into that. Yes, we will get into that.
And should we assume that youth means through 12 and under?
So it is 6.
Child is 6 to 12, 12.
Yes, so for adults, it is. Yep, no, you're fine. So for adults, it's those ages 19 and older. For child, it is the parents with children from the ages of 0 to 11, because we're not going to have 0 to 11-year-olds take the survey because Lord knows what will come back on that. And then for youth, it is grades 6 through 12. So that's specifically why we do the no sex, because sometimes they don't feel comfortable with those kids in middle school asking those questions. However, so we have always specifically surveyed youth in grades 6 through 12, but the CDC only surveys kids in grades 9 through 12. So for the comparison data, it's going to look a little bit different. So we'll have total 6 through 12, and then we break it down by 9 through 12, and that's where we can compare to the state and nation. So getting into the procedure, again, very similar for the child and adult. So we do a 2-wave mailing campaign. The first wave that goes out is the advanced wave. So that's specifically for adults. It was sent out to 6,000 adults ages 19 and older. So normally we do the 2,000, but we did do the extra oversampling of the Latino and African American population. So that's where the 6,000 comes in. So the advanced wave that went out was pretty much a letter sent saying, hey, you may be randomly selected to take this survey. Just some fun stuff in there. And then 6 weeks later, which is the first wave survey, surprise, guess what? They were randomly selected. And so they ended up getting the survey. So in that, we did provide a packet. So it was the written survey, a postage paid envelope for return, a $2 bill incentive, and then another letter saying the importance of the survey, what they're going to do with the data, that it's completely confidential and not tracked in any way. And again, if they wanted to take that online, they could. Again, very similar for the child. So the 2-wave mailing campaign, $2 incentive, and then we did send it out to 5,000 parents with children ages 0 to 11. We did.
Why is that?
So that's good. So normally for adult, we only do 2,000, and then it's actually technically more for child, and it's just because of the amount of kids that are in the county. So that's why we're trying to reach more parents for that. Yep. All right, so looking at the procedure for the youth, a little bit different. In grades 6 through 12, the schools and classrooms are randomly selected. Again, the survey is administered via online, so we specifically were only in the public schools. And then one thing that we do is the passive permission slips. So that's something that's we've always done and is very important. So basically, any classroom that was selected, the school sends out this permission slip that we send. So it's just this letter explaining kind of everything that's going on. And it includes every single section that will be asked on the survey. And then the parent will read through that. If they do not want their child to partake in the survey, then they have to send it back to the school. The school keeps track of it. And then when they are surveying, that child is removed from that classroom. Also, for those classrooms that we randomly select, we do something that's a general classroom. So for example, we're not going to do like algebra 2 or whatever. It's going to be a general health or something classroom that we specifically survey. So one other thing that we did that was a little bit new this year, so purposeful sampling. This was actually something that was supposed to be utilized last cycle, but we did not because of COVID. That put, real stump in there. But so this was something that the executive committee, when we were meeting and creating this contract, they were like, hey, we really want to do this. So what we did is us at HCNO, and we worked with the executive committee to create an RFP that was sent out. And so the contract was awarded to AG Sandbox in collaboration with BeAlive 365. So basically what that means is that the data collection that happened, the initial data collection that happened between February through May, again, this was specifically for adults, we sent the demographic information to our statistician. So what he did is he provided a breakdown saying, okay, there's this many people he broke it down by age, gender, race, and income throughout zip codes in Lucas County, Ohio. So the point of that is for us to go out and to specifically reach and get more surveys in those underrepresented areas. Yep, gender, age, okay. So we did get, that happened, in July of this year. And then we specifically got 185 additional surveys. So those 185 additional surveys were included in the final spreadsheet that we provided to our statistician to create the output of all the sections.
So that was the result of analyzing the data to the like we captured.
Yes. So we took the initial data collection that happened. We analyzed it again. We were still getting surveys in that time, but from what we got within that time frame, we took it, we analyzed it, and said, hey, these are the additional areas that we need to go to. And so specifically, AG Sandbox and BeAlive 365 went into those communities, worked with their resources. They just met with people. They did, I think, like different events and things like that, things throughout the summer. They kind of told them why it's important. And specifically to the people that did take these additional surveys did get a $10 gift card incentive as a thank you to help for additional data collection efforts. All right, so looking at the results, so we did have a total of 873 surveys that were completed. So that included the paper pencil that were mailed back in. That was from the QR codes specifically that were on the written survey. And then that also did include the 185 for the purposeful sampling. So normally when we break this down, we're able to provide certain margins of error and knowing kind of where we're landing. Because there were mixed methods used specifically for using online and paper pencil, we had to change our methodology a little bit. And so our statistician, Dr. Joseph Dake with the University of Toledo, he was able to break it down by white, African American, and Latino populations. So our margin of error that we were shooting for was 6%. For the white population, we got 400, so we were at 4.9%. So we were under that 6%. For the African American population, we were at 242, so that gave us a margin of error of 6.3%. So we were almost right at that 6%. And then for the Latino population, we were at 144, which gave us a margin of error of 8.1%. So we were a little off on that. So specifically in their introduction and throughout the report, we do have little disclaimers saying that the overall percentage for Lucas County, when interpreting the subgroups, just to be cautious when looking at that. So specifically, again, for the white or for the African American and Latino population. All right, so for the youth, we had a total of 20 schools that participated. So that was really good. One thing is that we had a total of 5 school districts participate. In the past, so for last cycle, we had a total of 7. We did have a couple school districts come to us and say that they are participating in OES, which is the Ohio Healthy Youth Environmental Survey. So that's something that's being offered by the state. It's free to these schools. It's something that we specifically do have an MOU with OES to work with. Again, so they're trying to kind of push all of the schools to go to OES. And then from that, we are able to do comparable data throughout other counties in Ohio. But with that, we did have a total of 493 surveys that were completed, which gave us a margin of error of 4.39%, which is very good. And then for the child results, so we did have a total of 244 surveys that were completed. Again, that included the paper pencil and the QR code. So we were not at the 6% margin of error, but specifically because of the mixed methods, we weren't able to completely calculate that. But I can say we were shooting for 223, so having 244 was very good, which makes it representative of the county. Again, I know that this is a lot to go over, so if you have any questions or anything, please feel free to ask, or you can refer to the appendix and the introduction because our statistician did provide a very good breakdown in there. Okay, that was a lot, so that was the hard part, I'll be honest. All right, so looking at the adult data, so we broke it down by general adults, African American adults, and Latino adults. So I know it's kind of hard to see, but just because of the shortened and what we're looking at today, we're not going to be looking at everything. So we'll be looking at adult tobacco use, alcohol consumption, drug use, and mental health, and then we'll be looking at specifically ACEs, also ACEs for the adult sections. Alrighty, so as you can see here, there's a lot on this graph, but I will explain it. So specifically what we're looking at here is smoking behaviors. At the bottom, you can see this was specifically the question that was asked on the survey, was asked, have you smoked at least 100 cigarettes in your entire life? If yes, do you smoke cigarettes? Do you now smoke cigarettes every day, some days, or not at all? So that, again, that's a CDC question right there. So that is exactly how they ask it. So over here to the very far left, we can see the total percentage for Lucas for 2023. We do have it broken down here by this lighter color being current smoker, former smoker in the orange, and then the very top we have never smoked. So as you can see here, we have these bars that are a little bit different colored with the shading. So the reason that we do this right here is to compare data from previous years so that you can see. Again, we can't include every year on here or else the graph would be very small and you wouldn't be able to see it. But that's why we have the comparison tables. So no worry there. So specifically here, we can see that there was a 3% decrease in those who never smoked. Of current smokers from 2020. We had a 1% decrease in those who were former smokers. And then from 2020, we did have a 4% increase in those who never smoked. Again, oh, sorry. I did want to point out here that we do break it down. I didn't even explain that. We do break it down by gender, age, income, and then specifically for here, we have white, African American, Latino, and then the next years. And then on the next graphs, we have it broken down. So specifically, this is looking at African American smoking behaviors. So then again, we have it broken down by total, male, female, age, and then income, and then we have data from the previous years. So specifically, we did see a decrease in those who are current smokers from the previous year. We did see an increase in we saw a decrease in former smokers, and then we did see an increase in those who had never smoked. So looking at the Latino population, so we did see a pretty significant decrease from 2020 of those who are current smokers. We saw a decrease in those who were also former smokers, and then we did see an increase of those who said that they never smoked. Okay, next we'll be looking at alcohol consumption. So specifically here, the question was asked, I don't know the exact wording, but basically the data that we're getting out of here is figuring out current drinker. So those who reported having at least one alcoholic drink in the past month, so the total was 59% of general adults. We see 64% of African American adults and 61% of Latino adults. So here, the data that we got out of this question was specifically binge drinking. So that is 5 or more alcoholic drinks for males or 4 more alcoholic drinks for females on a drinking occasion in the last month. So here we see it is at 26% for the general adults, 31% for African American adults, and 29% for Latino adults. All right, so here is where we have our comparison table. So as you can see here, we broke it down. So this was total general adults, and we have African American and then Latino. So we broke it down by current drinker, binge drinker, and drove after having perhaps too much alcohol to drink in the past month. So this first column here, again, we don't include every single year because again, it would be a very little comparison table. So we go all the way back to 2007, and then we have the current year here that is highlighted or that is in the green. And then specifically here, we have the Ohio and US. So we can see the trends from previous years. So again, we can see it went up, down, and then it's going down, but we are still over specifically the Ohio and US. So again, why does it say Ohio and US 2021? So this specifically is from the CDC, and for the year, the most recent year of data available to us was from 2021, unless identified otherwise in the bottom here. I think there were a couple that were from 2020, but again, that's the most recent data. So, any questions? I'm sorry if I'm going through this too fast.
Can we get a copy of this?
So we do, Julie, have it available at the Healthy Lucas, what's the website, sorry?
HealthyLucasCounty.org would have the entire assessment. But the presentation slides, yeah.
Sure.
Okay,
Yeah.
that'd be great.
Okay.
Yeah.
Yes,
So on the previous slide,
yes.
are we saying that fewer people, particularly in the overall population and the African American population, and all of them are driving less under the influence?
Let's see here. So we did see a decrease here. For African American, we did see an increase from 5% to 11%, and then we did see a 4% decrease here. So specifically in the general population and Latino, we did see decreases. However, we did see an increase here.
But not in Lucas County, under the African American.
Yes, not under the African American. We did see an increase here. And again, just with our data, I mean, there's so many limitations in the way that we collect data. Again, we'll see influxes, decreases, all that, but basically, it's not perfect how we collect it. That's why we rely also on secondary data. Again, obviously this data is very good. We generalize it to the county, but there are many limitations to the research. So, and then I know specifically for our indicators right here for Ohio and US for driving. So the most recent year was from 2020. So just, again, keep that in mind. So next, we're looking at drug use. So specifically looking at recreational marijuana use in the past month. So we have it broken down here. Let's see here. We do not have previous years. But we can see that it was at total at 6% for Lucas County. And then we did see an increase for males and those 30 and under. And then we see it the highest for those for African Americans at 9%.
Were you surprised by these numbers?
No, I wouldn't say. Compared to previous years, I mean, are you saying in reference to that these aren't as accurate, like that it's higher? I see where you're coming from. So specifically with my job with being a the subcontractor, so most of the data that we see is the data that we collect. So I'm used to the data, yeah, I'll have it on the next slide, but I'm used to data from previous years for Lucas County. So specifically, I would say it probably is lower. I'll just say that. It probably is lower. But overall, I would say no.
Not to interrupt, but we need to remember these are self-reported.
Yes.
People taking surveys, answering questions.
They think you're being
that-
truthful.
Yes, yeah. So again, it's one of the limitations.
I know so few people.
I know, right?
I do foresee this jumping up a lot, especially with the passing,
Yeah.
so.
People might be little like pushed to be a little.
Yeah.
Now that it's legal.
Yeah,
Yeah,
so,
considering 57% of the state voted yes for the law.
That's how we're sitting over
Surprises
each
you
other.
a little bit, doesn't it?
We're like, wait.
yeah, so again, that's why when we work,
I would say 70% of my friends.
so, I mean,
Don't count companies.
that's who we work with, and again, and I will say another thing to kind of consider with our limitations is that we do see a lot of older adults taking this survey. It's harder for us to get to that younger population. That's why we're trying to move online. The paper pencil, it's long. Older adults like to take it. They have the time. They like the $2 bill, stuff like that. So that's why we're trying to move it into new methodology. So that's something that we've been working on at HCMO. All right. So specifically here, again, we see that 9%. We see an increase for those for males. We also at 11% for those 30 to 64. And those actually with higher incomes, or incomes above 25,000. All right, so here we are looking at Latino. So we see the total at 4%, and we see it jump up to 8% for females, and then also 6% for those 30 years and under, and 5% for those with incomes above 25,000. So here we do have the comparison table, so we can see the comparisons from previous years. I do want to note with this question though, this question specifically was asked differently. So when you're looking at these previous years here, these were specifically, as you can see, adults who use marijuana in the past 6 months. So this is something, again, that was different for this round. So that's why I have this little asterisk here. The question was specifically asked adults who use recreational marijuana in the past month. So just keep that in mind. That can look very confusing. So again, please keep that in mind when reviewing. Unfortunately, we do not have data here to be comparable to the state and US, so we just are looking at these trends here. All right. Did you have a question? Oh, okay. All right. So next, we're looking at mental health, specifically those who felt sad or hopeless for 2 or more weeks in a row, which is defined for depression. So we see the total at 15% for Lucas County, and then we see a significant jump to those 30 and under, and then those with lower incomes. And so we can see between the 3 races that it was highest for African Americans at 22%, followed very closely by Latinos at 21%. So again, here we're looking at African Americans. So we see it at 22% and a very big jump here for females at 28% and those 30 and under at 35%. And then it's highest for those with lower incomes at 25%. I'm glad some of this.
Yeah.
And then next we have Latino adults, so total at 21%, and we jump up, we see females at 27, and we also see those with low incomes at 25%. All right, so next we'll be looking at social conditions, so specifically social determinants of health. What I took out of here was specifically the ACEs question. I know there's a lot of good data here, and a lot of counties like this specific question. So we see the question asking Lucas County adults experience the following adverse childhood experiences in their lifetime. So the top three that we can see here, their parents became separated or divorced, lived with someone who's a problem drinker or alcoholic, and a parent or adult in their home swore at them, insulted them, or put them down. And we can see down here that a total of 16% of Lucas County general adults experience 4 or more ACEs in their lifetime. So 4 or more of these. So this is the full list from the question, but I wanted to point out the top 3.
Is that
Yes.
startling? So many,
Are you referring to the
16%?
16% or up here?
16.
This is actually low. It's the highest for Latinos, I'm pretty sure. We'll look at it. It was the highest for Latinos at 29%.
So these stats here, there should be some correlation to the slide before, correct?
Are you talking about specifically all the substance abuse?
Yeah.
Yeah, so again, we are seeing, we do see a rise specifically for the health behaviors questions with substance abuse, other sections throughout the social determinants of health. So yeah, so there definitely is a correlation that we do see, yes. Okay, so this specifically is looking, oh, okay, here we go. Next is African American. So again, so these top 3 answers are usually, if you look at the top kind of 5 or 6, they're usually the same, a little bit up and down. But again, we see their parents became separated or divorced. So that's usually the top answer or in the top 3. A parent or adult swore at them, insulted them, or put them down, and their parents were not married. So then here we see a 14% total for those who experienced 4 or more ACEs in their lifetime for African American adults. And last, we're looking at Latino. So again, kind of the top 3. So I know that I think these were almost the same ones for the general adults. So I won't read those again, but we're seeing 36%, 36%, 29, and we see a total of 29% of Lucas County adults experience 4 or more ACEs in their lifetime. So definitely the highest for Latino adults in this specific, for this question. Okay, any questions about adult? We'll get into the youth, and then I'm trying to get through this quickly. Okay. So the question or the sections that we'll be looking at here: tobacco, alcohol consumption, substance use, mental health, and then we'll be looking at violence. So first, specifically looking at those who are current smokers. So this specifically is only referring to cigarette smokers. We do have one for vaping next, so I just wanted to clarify that. So we do see here specifically a 1% decrease from 2019. So here we're looking at 6th through 12th graders who use e-cigarettes or vapes in the past year. So we see the total at 13% for 2022, which was a 1% increase from 2019. And again, I would say overall, we are seeing a huge rise of the vaping and the lowering of tobacco nicotine for adults and children, or excuse me, adults and youth, not children. Sorry. And we see it highest for those 17 and older. So I will say, specifically, we see it the highest a lot for those 17 and older, and actually for females too. We see it the highest. So here is where the comparison table comes in. So I know it's a little confusing, so that's why I tried to bold it out. So here we have the total for those 6 through 12, so all youth in Lucas County. And then we break it down by the 9th through 12th, and that's where this comparison data to the state and nation come in. And specifically these years, we do have it as 9 through 12. And then in the report, in the introduction, we do break it down by minorities. So again, there's a lot of good data in the report. So, we're just very, very brief overview today. Next is alcohol consumption. So specifically youth who are current drinkers, we see it at 12%, and then the highest for those 17 and older. For binge drinking, again, we're at that 7%, and again, we see it highest for those 17 and older at 19%. And then we do have our comparison table here. So again, all youth in Lucas County, and then comparisons through high school. So we did see a huge increase here for those who obtained alcohol they drank by someone specifically giving it to them. So jumped up to 46% there. So next we have drug use, so specifically youth who used marijuana in the past month. Again, so we did actually see a decrease from 2019 down to 9%, but we did see it highest for those 14 to 16 years old and 17 to 19, which I think this will be very interesting to see because it's usually the highest, again, as I said, for 17 and older, but now we're looking that it's the same rate for those 14 to 16 years old. So it will be interesting if that continues to rise for the younger kids. Again, here are comparison tables. We do ask a question specifically who used illegal drugs. Usually those are very low, but specifically in this table, we're looking at use of cocaine, heroin, meth, steroids, inhalants, and ecstasy. Again, that is lifetime use, specifically for those questions. All right. This is a very cool question that I love. So specifically, we ask about perceived great risk of substance use. So right here, we're asking them total, like what is the greatest risk? Down here, we look at perceived degree of great disapproval by parents or guardians, and then we see it by peers. So we can see it the highest for those who said great risk of substance use was for drinking alcohol and misusing prescription drugs. And look how low it is at 39% for use marijuana. So that is almost, so we can see the decrease there, I would say, almost a 10% decrease. Specifically, sorry, I wanted we see it for highest for parents disapproving smoking cigarettes and using misusing prescription drugs at 68%. And the lowest at 56% for drinking alcohol. And then for peers, we see it the highest for misusing prescription drugs, and then the lowest for using marijuana at 36%. So that, again, will be interesting. Oh, it was drinking alcohol, sorry. Okay, so drinking alcohol closely followed by using marijuana. So again, with the passing of the bill, it will be interesting to watch these trends as we continue to survey. So specifically here, we're looking at depression. So we did see a decrease from 2019, and then the highest for females. It usually is the highest for females, specifically for this question. Here we're looking at youth who had seriously considered attempting suicide. So we did see a decrease from 2019. Again, you do have to remember that the last cycle that we did this, it was right in the height of COVID. So if we're seeing decreases.
The survey was done before COVID, right?
Oh, it was, wasn't it? Okay, it was. I'm sorry. Okay, so this survey was specifically done before COVID, but the adult had moved into the COVID, or into the, I mean, we're still in COVID, but you know what I mean. Okay, well then. And then the last one that we're looking at is youth who actually attempted suicide in the past year. So here we did see a 2% decrease, and then highest at 11% for those 14 to 16 years old. The last thing that we're looking at, so again, the ACEs question, so we asked this in the adult youth and child questionnaire. So we see parents became separated or divorced, parents were not married, and adults scored them and told them to put them down. And then we see it at 22% of youth had experienced 3 or more ACEs in their lifetime. Again, just one of the comparison tables that we have here. And the last section is youth violence. So specifically what we asked is the types of bullying that they experienced. So when we say verbally, we say through rumors, teased or taunted. Indirectly, we specifically say we're referring to like online via social media, or no, sorry, electronically is online and social media. Indirectly was through rumors, and verbally is like verbally saying to someone. And then physically, so like hit, punch, kicked, something like that. And then sexually, this is referring to, if they sent an inappropriate picture and it was used as blackmail or it was spread around. So we do break it down by total, males, females, and then the different age groups. All right, any questions about youth? Promise child is way shorter. I know I'm losing people, so I'm trying to get through this. Again, please remember this is for parents with children ages 0 to 11. So specifically, we'll be looking at middle childhood, family and community characteristics, and parentality. Again, so specifically, we're seeing that 52% of parents reported their child was bullied in the past year. So these were the different types of bullying. You see it top for verbally, physically, indirectly, and then electronically and sexually were the lowest. And then we see that 3% of parents reported they did not know if their child was bullied. So here is our ACEs question again, super important. Parents became or separated, divorced, lived with someone who had a problem with drugs or alcohol, and then lived with someone who was mentally ill, suicidal, or severely depressed. And we see that 13% of parents reported their child experienced 2 or more ACEs in their lifetime. All right, so the very last one that we'll be looking at, we do specifically have a section that parents can answer about themselves. So we see that 53% of parents rated their mental and emotional health as excellent, very good. That decreased to 15%, so a huge decrease there, of parents with annual incomes of less than $25,000. We see that 34% rated their mental and emotional health as good, and then 13% rated their mental and emotional health as fair or poor. And that is the end. That was a lot. I know it was. Are there any questions? Yes.
Sorry. Do you track anything by zip code where people live?
So we do. Are you specifically wanting to know a certain question that was asked, the zip code, like what their zip code was?
Yeah.
So that's hard. We can do that. That is dependent on the question and how many responses we get. So specifically, in order for something to be deemed statistically significant, we have to have at least 50 or more people respond. Because if we're looking at something by zip code, and say we're looking at obesity, and three people reported that they were obese, and we reported that out, it would be 100% of people in this zip code were obese. That's not statistically significant. So if you do want to see a specific question, I can look at the question, filter it out by the zip code, and let you know. I can't promise anything, but if you did want to see that, I could look into it for you.
I have a question.
Yes.
So when you did the youth, and you said you talked to schools,
Yes.
did you see a big difference between schools, which would be somewhat zip codes with youth, because the schools are in different areas?
I could look into that. We do ask them, I'm pretty sure that we asked them what their zip code was, but I would have to double check into that. We did that one a while ago,
Yeah.
so youth isn't as fresh. But are there any other questions? Again, I know that was a lot. Please read the entire report. There's a lot of good stuff in there. And if there is, if you do have additional questions or want something broken down, let me know. I can't promise it, but I can look into it for you.
And how can we get the digital version?
So it's on the healthylucascounty.org website. You can actually review it and download it.
We can send you guys the link. We look at it all the time.
You can like our Facebook page, follow us on Twitter also.
Again, if you have specific questions about the data, you can either reach out to Julie or you can directly reach out to me and I can look into it for you.
If you forget Facebook and Twitter, you can find me.
Yeah.
And this short version will be sent to the board members. Scott,
Pardon me?
this version will be sent to them.
Yeah,
This-
we can do that.
Yeah.
Send the PowerPoint out.
Oh, sure. Go ahead. Thank you very much. I appreciate it. For those of you who don't remember, we contributed $15,000 to the completion of this. And we integrate this information into our decision-making, specifically as we begin to plan and complete our community action plan for Ohio Moss, our strategic planning, our considerations as we begin the deliberations of what services should be funding currently, what needs to be renewed, what might need to be reduced. So this information, coupled with a few of the other data points in our community that we have access to that regularly show up in the plan or the semi-annual and annual report that Phil put together, but Julie, who's not here, will be putting together in the future. This data is vitally important to us as we begin and consider what we're going to do into the future. So thank you very much, and thank you to Erica. Sorry, I should have brought you in on this to begin with, so you knew this was gonna happen.
They do the hard work, trust me.
Thank you very much, and we really appreciate you taking the time today. Pastor, we can go ahead and move on with the agenda.
I found that very fascinating. So, going forward now, I guess,
Oh,
give your director's report.
I guess we'll just go quickly into a quick director's report. I know we're kind of getting late here. I've already introduced Stephanie, so we've got that taken care of. Stefana, thank you. Also, you should have received in your mailbox, if you live in Lucas County and reside in a single-family home, a card that says how to download and utilize our local Help Now application. That card went to 191,000 Lucas County residences. It's the first time we had ever made that bold of an advertisement. And we are very hopeful that it becomes and will likely become our main strategy to improve access into our treatment services. That is the first load was about 40 plus different organizations. We are continuing to evolve that and update that information. There'll be regular updates as the numbers allow. We're not just going to add one organization, then add another, then we're going to do bulk updating. So we really are really looking forward to analyzing the data behind on utilization, who's downloading, that kind of stuff. Yes, ma'am.
A lot of my seniors got the app to show them how to do it.
Well, we appreciate that. Thank you.
While I was doing the home visit.
It is a great tool to be put right at their home, right at their fingertips. So, also wanted to mention that on January 5th will be Toledo Walleye Mental Health Night. Unfortunately, it's not likely we're going to get a whole bunch of tickets to disperse, but you can go to their website and purchase tickets. We'd love to have a strong showing. We will be promoting our app. We will be promoting voter registration and many different things, and trying to get the word out about how to gain access to services if you need it. So
I would like for us to attend.
if you are so inclined and are a hockey fan, or maybe just maybe not a hockey fan, but you certainly love the camaraderie of your fellow trustees, we'd love to have you there. There isn't going to be one section or anything that we have though. So we will have that night, but then also we're invited back a couple of different times for putting a table out there. So 8,000 people. This is I think it's a Friday night game. It'll be jam-packed with folks, so it's a good opportunity for us. Also mentioned that we just finished a CIT class. 32 officers participated and completed. We got somewhere around 1,600 people, law enforcement officers now trained in Lucas County.
That's great.
I still maintain that it's one of the best CIT programs in the state. It's certainly, I believe, one of the most aggressive in training our law enforcement officers, and we continue to get great feedback on how to improve it. And Michael's team is doing a great job of managing that. Wanted to mention that a couple of months ago, you allocated 20,000, I think it was 23,000 through next fiscal year to the parent cafes and other groups, and just wanted you to know that those parent cafes are starting in mid-January already. So they were eagerly awaiting our allocations. And so for those of you that don't know what a parent cafe is, it's building support for parents by parents. You can call area code 419-251-2469 and talk to Tammy about the parent cafe and where it's going to be established and when the next ones are and all of that. We would encourage anybody interested or have parents to go ahead and that might be interested in that to go ahead and participate. But I brought this up as an example of real life example, real time. Boom, we got that money out there, and man, a month and a half later, we're starting to see results on this. So I know you guys were very interested in this, so I wanted to bring it up. Also, just a mention to the system that Ohio Medicaid rates increase on January 1, 2024. This was expected. We knew it was going to happen. We built it into our contracts and I should say our financial forecast, because as you know, our rates for treatment services are tied to Medicaid rates. So if theirs raise, ours raise. There isn't anything for us to do or for the agencies to do. That's all held within our invoicing system called GOSH. The rates will automatically adjust on January 1st, but the rates did increase by approximately 12%. At least the rates that I checked out, and I just randomly selected about four or five rates out of the 100 or so that are there. But I think that's fairly consistent. And it is a long overdue increase to the community mental health and addiction treatment facilities. They were working on rates from 2008, and this will go a long way to helping their bottom lines. So just wanted to make that mention. Our move is scheduled for February 13th through the 19th. We're not really sure on a specific date yet, but we are still on track, and things are going reasonably smooth with that move. And the levy campaign continues to move forward. Our kickoff date will be sent out to all you guys as soon as we confirm the location as available for the date. And need to recognize one more time our Miss Cynthia Brown Sherry. This is her last meeting as she's retiring on January 4th, I think, is it? 5th. Missed it by a day. But we want to thank you for all your service over these last 7 years. So thank you very much.
I thank the board for hiring me. It's been a very good 8 years.
8 years, thank you. And I just asked you that. So,
Yes.
And then finally, happy holidays to everybody. Really appreciate your support over these last couple of years, and wish you all very well into the new year. That's it.
Thank you, Scott.
Yeah, Scott, is the oversight committee going to meet on January 2nd?
Yes, it is. That's the plan right now.
I'll tell Christina.
Whom do we say thank you for the goodies that's over there?
That's Susie. She took it out of her pocket. She's a good girl, that Susie. Open session.
Our open session is now. Yes, Richard.
A lot going on. I will be brief. I've reported to you in the past that last year New York City started picking up people with mental illness, even though they have not been involved in criminal activity and forcing them into treatment. In October, 7 counties in California, including San Francisco, started doing the same thing. In December, the first Los Angeles started with its care court, which means first responders can pick someone up, even if they're not involved in criminal activity, and they can be compelled into treatment. So the gradual erosion of civil rights for people with mental illness continues. I'll continue to follow that. Don't have much information on this. National Church Residences will partner with Area Office on Aging. They are going to establish a 68-bed facility at 2155 Arlington. It will be affordable senior housing, and I too believe that is right across the street from where Danny's place is going to be. So that area is going to see a lot of change. They will go before the Plan Commission on January the 11th, and they will go before Zoning and Planning City Council on February the 14th. Commissioners did approve the maximum price with Lathrop for moving this agency and children's services to 333 Summit. It's $3.6 million. They didn't discuss it. We just went ahead and approved it. They did place Santa Claus at their last meeting of the year. They gave out 2 grants to Lucas County Local Housing Authority, one to YWCA, one to Enrichment, and they're going to give $400,000 to Unison for their proposed facility at 5052 Door Street. You don't remember this. It was proposed in 2020. It was turned down. The neighbors don't want it. It needed spacing requirements because it is near both a daycare center and a group home. They brought it back 2 years later, May of last year. They said, okay, it's going to be both substance abuse and mental health. It was disapproved by the Zoning and Planning Committee, but approved at City Council. That doesn't happen very often. I know that the neighbors were unhappy about it. A year and a half has come and gone. They did reapply for their special use permit in May of this year, so they've got until May of next year. They're going to get $400,000 from the county commissioners. This is recovery money, and they didn't discuss it very much. They just approved it. And Scott was mentioning, I got my, I dug this out of my files. This is a mental health, what is it, May the 28th, 2020, that was the height of the pandemic. It's an editorial in the Blade, very interesting. It says that there was a group in Europe called Privacy International. They were very, very concerned that when you go to these websites, your information is collected and shared with third parties for purposes of targeted advertising. They lobbied the European Union successfully, and rules and regulations were created. But to the best of my knowledge, nothing like that has happened in this country. So I guess my question is, do we know when people go to these websites, will they be asked for information which can be shared with third parties for whatever purpose? And I was puzzled by the postmark. The bulk memos that you usually send out do list Toledo. This one lists Kansas City, Missouri. I have no idea why. But I'm trying to find out, when people go to this website, will they be asked for information that can be shared with a third party? And why are you not using a different postage page? So those are my 2 questions. Thank you for the opportunity to speak.
Yes.
I will also make this very quick. Matt Bell, Team Recovery, 3 things. So One Ohio Foundation, I believe, is making some good progress. Q2, did they say? Hopefully things should be Q2, and so definitely looking forward to seeing some money is available for Region 4.
Excuse me, Matt. Context, Matt is now the chair of the Region 4 Ohio Foundation, One Ohio Foundation.
Thank you. Small win for Team Recovery, Senate Bill 105, more regulations on recovery residences being registered through the state as well. We had ORH, Ohio Recovery Housing, at our sober living about a month ago, and the board just approved that all of our 150 beds are now ORH certified. So we're very excited about that. Figured I would share that with you all. And then the third thing is Team Recovery is announcing for 2024, we're trying to figure out how to give back to the community. Many of us at Team Recovery wouldn't be here if it weren't for the county and funding that was available to many of us when we needed to go through treatment. And so part of our, I guess, philanthropic mindset is to, we started something called the Team Funds. We're allocating $30,000 to agencies in Lucas County, just really in an effort to drive community collaboration. Agencies that are accredited through OMAS and either Joint Commission or CARF that serve adults or adolescents with addiction or mental health needs. We're giving out $2,500 a month to those agencies, again, in an effort to just collaborate with as many places as we possibly can. We're relatively new in this area in terms of providing services, and so developing relationships, regardless of what that need is for, hopefully relieving some of the cumbersome applications and review and all this kind of stuff from the board. And so part of that process is support from the board, not contingent upon support from the board, but we have the autonomy to make that decision on grant approval or not. So just wanted to announce that as well. It's just a small token of our appreciation for the amazing work that agencies do in this area. And so please, if you know somebody that is in need of those funds, granted it's not a ton of money, but have them apply. It'll be on our website.
How do they get up?
It's on our website, teamrecoveryohio.com. It's at the very top, along with all the other tabs. It's called the Team Funds. It's a very simple application. Thank you.
Thank you, man. Anyone else?
No, but I want to apologize. I just got new hearing aids and I have to learn how to use them. And you could do direction. I can point it towards you and I can hear you better. I can point it towards you. But I have to have my phone on. So that's why when the phone rings, it's like, ah. But I'll try to get that worked out.
Thank you for sharing that with us. All right, meeting adjourned.
Thanks, everybody.
Happy holiday, everyone.
Hey, help yourself to some cookies over here or something. Feel free to stick around for a little bit.